Hey, this is Taj with my week 3 update for you. You'll notice the background, the environment's a little bit different this time. I realize that when I start my treatment, I'm not going to be able to record in my voiceover booth, which you see behind me with my really nice microphone and all my really cool toys. I'm going to have the phone and a lavalier microphone. So I have that, and I'm going to use that for this week's update. It's been 3 weeks since I learned that I had cancer. I spent 2 days this last week in Houston at the MD Anderson Cancer Center. I was poked, prodded, X-rayed, CT scanned, motion X-rayed, stuck with a really big needle, and met with and/or been examined by about a dozen doctors, residents, nurse practitioners, technicians, a pharmacist, a social worker, and even a dentist. Yeah. Fred took all different kinds of new selfies during my little trip, including this X-ray, this CT scan, this PET scan, which actually proves that I have a brain. The bright spots are the areas of activity. The bright lump there in my throat is Fred. The dark spot in the center of my brain there is the part that tells other people when to stop talking. Just kidding, that's not really true. But the coolest test by far was the modified barium swallow. No, that's not a rare type of bird. You swallow food coated with radioactive barium while they take a video X-ray to see how the muscles and structures in your throat are working and how your swallower swallows. So let's take a look at that. This darker blackish line that is sticking out and pointing toward the back of my throat is the top part of Fred. The tumor has invaded into the base of my tongue and is attached to the top side of my epiglottis. That's the little flap that folds over your windpipe when you swallow food. Mine's not working exactly right because the base of my tongue pulls Fred one way and the epiglottis pulls it the other way. So Fred's in a tug of war with my tongue and my epiglottis. Fred's going to lose. So everyone at MD Anderson was great, but why go to MD Anderson, especially when I have an MD Anderson Partner Cancer Center here in my hometown? Well, it's a good question, but I want to share the reasoning with you because I think it's important. Head and neck cancers account for only 4% of all the cancers diagnosed in the United States every year. My specific base of tongue squamous cell carcinoma cancer is a very, very small subset of that 4%. And squamous cell carcinoma that is not caused by tobacco use or heavy drinking is an even smaller subset of that 4%. Most oncologists, they said, will see only 5 or 10 cases of head and neck cancer in a 30 to 40 year career. Some may never see a throat cancer, and especially one like mine that's not caused or greatly contributed to by tobacco use. MD Anderson in Houston has 2 entire floors of their hospital dedicated to head and neck cancers. They have an entire team of medical professionals who do nothing but cure head and neck cancers and train new doctors on how to cure it. That's it. That's all they do. A couple of them even specialize in my cancer and in this location. I am literally at MD Anderson in Houston going to be getting the best care available in the world. And I want to be clear that my choice to go to MD Anderson in Houston as opposed to the MD Anderson Partner Cancer Center here in Tyler, Texas, it's not a slight or an insult or in any way demeaning what they do. They do great work here. They were the ones who insisted that I go to Houston for a second opinion because they know the quality of the resources that are available there and how rare my cancer is. So in my opinion, it's really great to know that you've got physicians at the MD Anderson Partner Cancer Center in my hometown who are willing to put their egos aside and send me somewhere else because they believe I'll get a better outcome there. That makes me trust them even more. So what did I learn this week? Well, a couple of things. Good news, they downgraded my tumor from stage 4 to stage 3. Now, in most cases, stage 4 means incurable. They told me when I was diagnosed as stage 4 that that's not what this meant, that because this cancer responds well to treatment, that stage 4 doesn't mean incurable, that it would be curable, that had more to do with the size of the tumor and how much it had invaded into the base of my tongue and the fact that the lymph nodes were involved and that kind of thing. But they've downgraded it from stage 4 to stage 3. That doesn't have anything to do with the change in the size or the shape or the location or the intensity of my tumor. There were new guidelines that came out in January about staging this type of tumor in this location not caused by tobacco use or heavy drinking. So what this means practically is that Fred is just a little more likely to respond well to treatment than we previously thought, but that's a good thing. Now, the best news as far as I'm concerned is that MD Anderson Houston is going to be able to place what's called a larynx block in my radiation mask to protect my vocal cords. The way they described it, if you can imagine the water of a river flowing and a wedge being placed in that river, and the water hits the wedge and goes around it. Most of the radiation will hit this larynx block and go around my vocal cords. In addition, they are going to place what's called a dental dam to protect the roof of my mouth and one of my salivary glands. You have 3 primary salivary glands. The most important one is here. That one will be damaged or destroyed. And you have 2 on either side of your mouth, kind of in front of the bottom of your ears. I'm not sure exactly where they're located. But they are going to determine which one of these 2 salivary glands functions the best. And they will protect it by essentially shooting around it when they are hitting Fred, who is kind of in this area. They will shoot radiation around it. What that means, again, practically, is a less risk of severe side effects or permanent damage to my vocal cords. It also means that my taste buds may return to function normally within a year, and that I should still have some salivary function, which will help reduce dry mouth. It's kind of weird, and this is gross, but there's a medical way to say it, and there's a normal way to say it. The normal way to say it is, I have always produced a lot of spit. Working on the radio, and particularly working on television, I frequently had to swallow or to kind of dry my mouth out a little bit. Radiation's going to do that for me, and it's going to do it permanently. So hopefully it'll balance out, and I'll just end up with a normal amount of saliva. So the plan, at this point, I will return to MD Anderson later this month for final testing, and I'll begin treatment within a week or 2 after that. I'll be in Houston for 7 weeks and then go back after a couple of months for follow-up testing to confirm that Fred is dead. I'll hear from them later this week with the exact dates of when I'm going to start my treatment. Now, I'm going to be honest, I'm nervous. I know this is going to be hard. Support system is extremely important when you're going through cancer treatment. And I'm going to be 300 plus miles away from my support system. Now, thanks to the wonders of modern technology, there will be FaceTime, there will be phone calls, there will be text messages, there will be Facebook posts. And I know we'll be able to stay in touch, and I know people will be encouraging me, but it's just not the same as a hug. That's going to be rough, and it's going to make treatment a little rougher. But I also have some friends in Houston, actually friends who work at MD Anderson Cancer Center, so I'll be able to see them some. But I also know that treatment's going to hurt. This is going to be an extremely unpleasant experience. I've talked to a lot of people who've been through radiation for head and neck cancer. I have watched a lot of YouTube videos of folks who've been through radiation. The description I hear over and over and over again is, imagine the worst sunburn you've ever had or the worst sunburn you've ever seen. Now put that on the inside of your mouth and throat. And that's what it's going to feel like. And it gets progressively worse over the course of treatment. And it continues for a few weeks after treatment. And then within a couple of weeks to a month, things start to get back to normal. So it's going to hurt a lot. And when I deal with chronic pain because of a back injury, so I believe I'm going to be able to deal with that. I've got a lot of people at MD Anderson helping me, in addition to the people I've described already. I have a speech pathologist who's going to work with me exclusively on maintaining the ability to swallow so that I can continue to consume foods through my mouth to keep my protein up, to keep my calories up, to keep my weight up, and also so that I can return to a normal life more quickly after treatment is over. These folks take this all very seriously, and they don't play around, and they don't skimp on providing you the resources you need to make it through your treatment successfully. So when the treatment is over, Fred will be dead, I will be very much alive, and the doctors told me to expect to outlive Fred by 20 to 30 years. So Fred, to you, I say, nana nana boo boo. We know where you are, and we are coming after you. That's all the update I have for right now. Again, as always, if you have any comments or questions, please leave those below the video, and I will get to those as quickly as possible. Reminder, I am not a medical professional. I don't play one on YouTube, so I cannot answer any medical questions for you, but I will be happy to share about my experience. And based on what I have seen so far, I can wholeheartedly recommend the MD Anderson Cancer Center in Houston as a place to go if you, God forbid, are ever faced with a cancer diagnosis. I do want to share one humorous, ironic thing. As I mentioned, I work at the university in Tyler, Texas. That is the location of the MD Anderson Partner Cancer Center. And someone mentioned that it was 1 year ago this past week when we were in Houston for our training to begin working with the MD Anderson partnership. And so 1 year later, the same week, I was in Houston at MD Anderson as a patient. And I thought, okay, that's not how I wanted to celebrate this anniversary, but that's okay. I try to find the irony and the humor in this. I hope that doesn't bother you. I hope you don't think that I'm minimizing cancer, that I'm making fun of cancer or making light of it. I am making fun of my tumor. I have personalized my tumor. I have named it Fred. I am going to pick on it and bully it and call it names and harass it and talk badly about it until it's dead, and probably for the rest of my life after that, because doing that, being sarcastic and making jokes about this, helps me deal with having cancer and going through cancer treatment. It helps me emotionally to deal with that. And I actually talked with my social worker about this. And I want to share this in case you are dealing with a cancer diagnosis and maybe someone's been critical of the way you deal with it. Maybe the way you deal with it is to curl up in a ball and cry. This is what the social worker said. As long as you are not harming yourself, harming someone else, or breaking the law, how you deal emotionally with a cancer diagnosis is the right way to deal with it. Maybe you go in a room and punch a pillow and scream and, yell profanities. That's okay. Maybe you just need to be with people. Maybe you just need somebody to hold your hand or to hug you. That's okay. Maybe you're a sarcastic smart aleck and you name your tumor and create a Facebook group and make videos to put on YouTube to make fun of your tumor and try to help other people with a little bit of information. According to my social worker, in her professional opinion, that's okay. So I will talk to you next week. Have a great week, and let's kill Fred.